Hello again, everyone. Mr. B here. So we're continuing with Chapter 13, and we're going to be covering 2 modules today. And if we look at the review guide, there's going to be just a few things to be focusing on. So let's get right into it. So as I mentioned, we're going to be covering 2 modules today. And so this is when we start to look into various psychological disorders. So yesterday we talked about what it actually means to have an abnormal behavior. How is that classified? What criteria is it? How do we describe why it happens? Now we're going into the different diagnoses that you can get for psychological disorders. It should be noted that, of course, these are not all of them. These are just a few. Another very quick disclaimer, do not use this as a way to self-diagnose. If, while you are learning about these psychological disorders, you believe that you may suffer from one, then please go and see a therapist, a counselor, psychologist, anything like that, to get some assistance that you may need. But please, please, please don't use this lesson and this class to diagnose yourself. Let's get into it with anxiety-related disorders. And so what we mean by anxiety is an emotional state of uneasiness or distress associated with worry or apprehension about the future. So when someone has anxiety of some way, shape, or form, that's what we mean. And some different forms of anxiety-related disorders. One is a phobia. And this is when you have an irrational or excessive fear of a particular object or a situation. And this is the first thing that you will need to know for the exam. The example that I always give for myself, because I like to embarrass myself, is that I have a phobia of eggplant. I know that eggplant can't hurt me. I know that it's not harmful, and yet I have a fear of it. So that would be considered irrational and excessive. People that are scared of spiders, depending on how they behave, would determine whether or not it's a fear versus a phobia. So, if someone sees a spider and they go, "Oh, it's a spider," that's a fear of a spider. But if just the pure mention of a spider causes someone to freak out, that could be potentially a phobia. And I'm going to be including a video of someone that was on a talk show where they talked about their phobia of peaches. And so that would, again, be an example of a phobia because the fear that you have for it is irrational or excessive. So it's either beyond what's considered kind of a normal amount of fear, or I should say it's fear that usually isn't placed upon that object or situation. Another anxiety disorder or anxiety-related disorder is a panic disorder. And this is when you just all of a sudden have these extreme sudden episodes of terror, also known as panic attacks. So you can be perfectly fine going about your day, and then you're hit with a panic attack. And that would be considered a panic disorder. This is different from another one known as generalized anxiety disorder, where instead of having these kind of sudden and intense attacks of panic, you just have this persistent kind of nagging feeling of anxiety that's not really tied to anything. So it's not that it's these sudden episodes that come about, it's just this constant anxiety that you have weighing on your shoulders that just seems to go with you wherever you go. And then the last one that we talk about for the sake of this class is obsessive-compulsive disorder. And when we talk about obsessive-compulsive disorder, when we break that down, you have an obsession and you have a compulsion. An obsession is the thought process. So you have this persistent thought, this persistent kind of nagging feeling. And then the compulsion is kind of the action. It's something that you have to do. It's a ritual. It's this urge. And so when you have obsessive-compulsive disorder, it means that you have this kind of nagging feeling over and over and over again. And so you have to do this repetitive behavior over and over and over again. And for the sake of the exam, I would keep that in mind, this whole idea of this nagging feeling. And an example is if ever you were about to go on a vacation or a long trip, And so you pack a bag with, a few things that you think you might need. And before you leave the house, you start getting this kind of nagging feeling. It's like, okay, did I forget something really important? Did I get my toothbrush? Did I get my comb? Did I have a change of underwear? And so you go back and you check. And then you make sure everything's, in your bag. Then you're leaving your house again. You're like, oh, wait a minute, do I really have everything that I need? And so you go in your bag again and you check. This does not mean that you have obsessive compulsive disorder, but that is an example of an obsession and a compulsion that a lot of people have. Another one is when you set an alarm for a very important, event the next day. And then, you set the alarm, you put your phone down, and a couple seconds later, you're like, well, let me make sure that my alarm is in my phone. Again, it's having to check it over and over and over again. This does not mean that you have obsessive compulsive disorder, because for us, maybe it's checking it 1 or 2 times. For obsessive compulsive disorder, it gets to the point where a person cannot function a lot of the times because they just constantly have that nagging feeling and it never goes away. But that's some examples of obsessive compulsive disorder, or OCD. And I will also include a quick music video that's entertaining but also educational and kind of gives some examples for obsessive compulsive disorder, or OCD. And because we're always looking at the different perspectives of psychology, you'll see that we're going to bring up different models for explaining these different psychological disorders. So for panic or anxiety, we're going to talk about a cognitive model, where the idea is that you have this trigger. So there's something that happens that brings about this anxiety or this panic. And so cognitively speaking, you perceive it as a threat. So something happens and you see and you think, this is going to hurt me in some way, shape, or form. This is a bad thing. And so this makes you worried. This makes you anxious. This gives you that panic. And so because you're getting anxious, because you're having that panic, you have this bodily sensation. You start sweating, your hands start trembling, you feel really nervous. And so that leads to a catastrophic interpretation of those sensations. So you realize that your hands are shaking, maybe you're hyperventilating a little bit, you're getting sweaty. And so because of that reaction, you perceive it as a threat. And then it's just this constant spiral that leads to more and more anxiety and panic. And so one thing that really helps when it comes to anxiety disorders is doing something known as grounding, where you want to try to stop this cycle. And so one thing that people will do when they're having a panic attack is they'll just quickly stop and try to bring themselves back to now, instead of perceiving this as this kind of future threat. And so they might think to themselves, okay, what's 3 things that I can see right now? What's 2 things that I can hear right now? What's 1 thing that I can touch right now? And just by going through that thought process, instead of having this thought of, oh God, what's going to happen? Oh, I'm freaking out. It brings you back to the present. It can help to relieve that anxiety, and that's known as grounding. And this is just an overview of looking at agoraphobia, which is one of the more common phobias out there, where it's the fear of or avoidance of public places. And then it looks at some of the other disorders out there and kind of the prevalence that we see in the general population. And now we're going to get into dissociative and somatic symptoms and related disorders. So the first one is dissociative disorders and their causes. And so a dissociative disorder is when you have this disruption in your memory, in your consciousness, or in your identity. And the most commonly known one is known as dissociative identity disorder, or DID. This used to be known as multiple personality disorders, and in fact it used to be classified as something known as a personality disorder, which we are going to talk about tomorrow. But now it's known as a dissociative disorder because it's a disruption of your identity. And it's when you have 2 or more personalities within one individual that you cycle through. If you've ever seen the movie Split, this shows kind of a representation of dissociative identity disorder, or these, again, what used to be known as multiple personalities. And what you will need to know on the exam is essentially dissociative identity disorder, is when you become, as it were, a different person. Another less commonly known but still a dissociative disorder is dissociative amnesia, where instead of kind of becoming a different person, what happens is you just suddenly have this memory loss. There's no trauma, there was no head injury, there was nothing that would have brought about memory loss, and yet this person or individual suddenly forgets who they are. There's something also known as dissociative amnesia, and fugue, where a person both forgets who they are and just gets up and leaves. They travel, they go away. But the categorization here for dissociative amnesia is when you have that memory loss that just seems to have no physical cause. Then we get into somatic symptoms and related disorders. And one such disorder is conversion disorder, where there is this significant loss or change in a physical function. So something is happening to them physically that cannot be explained by a medical cause. So it is something that is happening to an individual physically, but there's no explanation as to why. Instead, it seems to be psychological. This also can be accompanied by something known as la belle indifference, which is French, so la belle indifference. I'm really bad at pronouncing, I apologize. This is also known as the beautiful indifference, and it's when someone has a lack of emotional reaction or concern to that loss of a physical function. And you will need to know this for the exam. And again, it's a functional neurological symptom disorder where you're just not concerned with that symptom. An example of this is a person that winds up in the hospital because they've suddenly become paralyzed from the waist down. And doctors run all sorts of tests, and, they find nothing wrong, but, the person seems paralyzed from the waist down. And the person comes in, they're just like, yep, can't walk anymore. Guess my legs don't work. And they just don't seem concerned. And again, that's abnormal. With something so big as suddenly becoming paralyzed, usually a person is more concerned with that. And so that is what we would see as la belle indifference. Another example of this conversion disorder is what's known as night blindness. And this was found in bombers that would be sent on missions, to go blow up areas in the middle of the night. For stealth and all that, and these pilots would just suddenly lose their eyesight, so they couldn't fly their planes and bomb an area. And there was no medical explanation as to why they were suddenly going blind, but they just suddenly went blind, and so, they couldn't fly their plane. And so the idea was that it was the psychological distress that these bombers didn't want to be responsible, and so through that kind of thought process, they became blind. So that's just an example. Then we also have somatic symptom disorder. This is what used to be known as hypochondriasis, or being a hypochondriac. And these are people that really do have physical complaints and symptoms. They do have these symptoms. They are happening, but it's essentially blown out of proportion, and they're overly concerned with it. So, they get this soreness in their knee, and they're worried that, they're going to have to get their leg chopped off. It's exaggerating these symptoms. It's not, symptoms coming out of nowhere. There is something going on. Usually it's something minor, like, maybe they pulled a muscle in their knee, and that's why their knee hurts. But their mind blows it out of control. And so that's what we mean by somatic symptom disorder. Again, used to be known as being a hypochondriac. And then this just talks again about the prevalence, kind of some features and various combats of those disorders that we just went over. And so, that's actually it. And so we will be back. We're going to be covering the last three kind of major symptom or psychological disorders, categories in the next video. So I will see you guys then.